Hello, welcome to Noble Nursing Education. My name is Jill Landry. I am a registered nurse. This platform was designed to help our future generation of nurses enter the nursing practice. Today's topic is going to be on the NCLEX examination. The NCLEX is the National Council of Licensing Examination. These tests are designed by the National Council of State Board of Nursing. The National Council of State Board of Nursing is in each state. Each one is different and has different requirements to take the NCLEX examination. So when you're preparing to test, definitely make sure to look up on their website to ensure that you meet the requirements to apply to test. There's so much information out there and so much information that we learn in nursing school, it can be kind of overwhelming to think about how to study for it. What is recommended is to definitely get a good study guide book, and also your nursing school resources can be helpful as well. The other source is the National Council of State Board of Nursing website. They have pre-tests that you can take, and they are made up of old test questions that have been retired. This will kind of give you a general idea of what to expect on the test and kind of ease some of that anxiety. So currently for this platform, we have two books that we're going to be using. These resources include the Saunders Comprehensive Review for NCLEX-RN Examination, and then the Lewis's Medical Surgical Nursing Guide. So the NCLEX examination is a computer adaptive testing format. You have between 85 and 150 questions that can be asked. You continually get questions until you receive a pass or a fail score. So the NCLEX is generally scheduled through Pearson VUE sites. And you have to get authorizations to test by submitting different information based on your state. When you do get the authorization to test, make sure that you follow their outline for testing and what you need for those days, including your IDs and authorization to test paperwork. So the test is set up similar to a college placement test, so where you'll continually test until you pass that certain area. The specific frameworks for the NCLEX here is based currently on client needs and integrated processes. With underneath the client needs, the subcategories that they test on is providing safe and effective care environment, health promotion and maintenance, psychosocial integrity, and physiological integrity. So there's also integrated processes with nurses. So applying caring to your nursing care, communication and documentation, cultural and spirituality, following the nursing process, and teaching and learning. So starting April of 2023, they also switched it up a little to include what they called the NGN, which is the next generation of NCLEX. This focuses on clinical judgment skills. So the testing in this area includes testing for 6 cognitive skills: recognizing cues, analyzing cues, prioritizing hypothesis, generating solutions, taking nursing action, and evaluating outcomes. So with the next generation NCLEX and the cognitive skills focus, they want you to focus on a couple different areas. Specifically, you may get a case study that slowly unfolds and you'll have questions based on the situation that they give you or the case study. Each one of these topics will be graded in those case studies. So the first one is recognizing cues. So identifying significant data, and this can be through your patient's physical assessment or just walking in and seeing your patient. What are you seeing? What kind of clinical presentation are they presenting with? So just recognizing, are they not doing well? Is their breathing off? What is happening there? Recognizing those cues. Then once you recognize the different cues, it's analyzing these cues. So it's being able to connect the data to the patient's clinical or presentation. So if you're going through their chart or looking at their labs, being able to identify, things that are common with certain disease processes, different presenting conditions, and what we see with lab values, just connecting the data, significant data, to how the client's presenting. So it's just an analysis. And then prioritizing hypothesis. So ranking your hypothesis about what's going on with this patient, and placing the patient needs based on priority. So if there's multiple things going on, ranking these hypotheses of what's happening to plan your interventions based on priority. So after that, you're going to generate some solutions. So using the hypothesis of what's going on with the patient, or your patient's needs, to determine an intervention. So your patient interventions for an expected outcome. So this is more planning. So, if you're coming in and you're recognizing that the patient is in a lot of pain, you can see that by their grimacing, things like that. You could do that from a quick, during your physical assessment, or you can also do that just by coming in and visually seeing that. Analyzing cues, connecting to data in clinical presentation. So the patient has a history of back pain. We have imaging showing that there is some deformities going on based on maybe some disease process, degenerative bone disease, something like that. And then prioritizing based on if there's multiple issues at hand, which one we deal with first. With this one, determining an intervention for expected outcomes, we could do, figuring out what kind of pain management has worked in the past. Repositioning sometimes can help, different heat, things like that. Just because we know from past history that an expected outcome is decrease in pain. Also, of course, medications. Taking action, so this would be the last part, so taking action on that intervention that you determined for your patient to generate solutions. So it's also focusing on the highest priority with this. So the cognitive skill is not only just the nursing assessment and creating nursing interventions and care plans, but also identifying the most important, highest priority. And then, of course, evaluating the outcomes, comparing observed outcomes with the expected outcomes. Is that what you expected? Is there something else that could maybe work better with the new information that you got when you evaluated? Things like that. So this is kind of a newer portion of the NCLEX, just to kind of look out for. It's just not just one question with one answer. It's really deeper into thought, using your cognitive clinical skills and evaluation to answer the questions. So the types of questions found on the NCLEX, you will find multiple choice, which is also select all that apply, fill in the blank, which is generally used for nursing dosage calculations, pharmacological questions, things like that. Ordered responses is mainly putting things in order based on prioritization, maybe with a skill or a patient need. Images, so this is more of determining areas of concern. They'll show you a picture, maybe different hot spots for pressures, things like that. Also charts and exhibits. This is more, this can be, lung sounds, this can be audio, video, this can be an image. So this can be kind of variable, but a lot of different things can pop up in these exams. But just be prepared. They may play you audio sounds of lung sounds, heart, bowel sounds, and kind of have you assess and determine what you're hearing. So, and then of course with the NGN, the new NCLEX that they have been discussing, is you will get each candidate gets 3 unfolding case studies. And so this will be given throughout the 85 questions or the 150 depending. It should be within the first 85. But then there'll be questions where they'll do the case study and then they'll ask you multiple questions based on the case study and determine your answers. These are all either pass or fail questions, 0 or 1 point. Some of them with the NGN have some different kind of score grading that's a little bit more in depth based on you get maybe partial points, but you don't generally get negative points. But that's that's a newer thing that they're doing there for that. So based on test percentages and passing scores, the safe and effective care environment, the subcategory of management of care, test percentages, 17 to 23% of the test should be, or scoring will be based on that. Safety and infection control, 9 to 15%. Then we got health, promotion, and maintenance. And in that category, you could have up to 6 to 12% of your test score come from this section. Psychosocial integrity, 6 to 12%. And physiological integrity, which includes basic care and comfort, pharmacological and paternal therapies, reduction of risk potential, and physiological adaptation. So these are all the different things that the NCLEX will be testing on, and hopefully this will help you out a little bit when you're preparing for testing. Thank you.